Welcome to Elite Health Plan's 2026 Compliance and Anti-Fraud Training, including compliance in general, HIPAA, cybersecurity, and fraud-based abuse. I'm glad you're here. In this session, we will cover what compliance means, why it matters, and what each of us must do every day to protect members, protect the plan, and protect information. Please listen for reporting options and key reminders. And remember, when in doubt, ask compliance. Takeaway from this slide should be that compliance is everyone's job, and asking questions early prevents problems later. What is healthcare compliance? Well, it's an ongoing process. It's the meeting and ideally exceeding the legal, ethical, and professional standards that apply to our work. The compliance program is how an organization builds a culture that prevents, detects, corrects fraud, waste, abuse, and other issues of noncompliance. It includes written policies, training for staff, internal and external, oversight of internal and external processes, the reporting of any issues of noncompliance and general operations, and follow-up actions to ensure that mistakes or issues of noncompliance or fraud, waste, and abuse do not happen again. Compliance is not just a department, it's a shared responsibility across every role in the organization. The takeaway from this slide would be to follow the rules, follow policy, and speak up when something seems off. Why do we have a compliance program? First, it's required. It supports our ability to keep our contract with the Centers for Medicare and Medicaid Services, or CMS, so we can offer Medicare Advantage and prescription drug products to Medicare-eligible individuals. Second, it's the right thing to do. An effective program helps prevent, detect, and correct issues of noncompliance and fraud, waste, and abuse. It improves our operations and also supports better care and better service for our members. The takeaway from this slide would be that compliance protects our CMS contract and protects the care and service that our members receive. Having a corporate compliance policy means that we commit internally and externally to conduct business professionally and ethically, following standards of conduct and complying with all state and federal laws and regulations that govern our plan and our industry. We also expect the same integrity from our business partners, which are our first tier, downstream, and related entities. These are our delegated provider groups and our members and our staff associates. Ethics is practical. It's how we act when we handle member information, process claims, communicate with members, and how we make decisions. The takeaway from this slide is that we should be acting with integrity at all times and expect the same from our partners and vendors. What is the structure of an effective compliance program? At least it must include these 7 core elements. 1, compliance-focused procedures. 2, a compliance officer and compliance committee. 3, training and education. 4, effective lines of communication. 5, well-publicized standards of conduct and disciplinary actions. 6, risk assessments and work plans, plus ongoing monitoring, auditing, and reporting. 7, prompt detection, prevention, and mitigation of noncompliance and fraud, waste, and abuse. Together, these elements form a complete system. Takeaway from this slide should be that a strong compliance program requires structure, training, communication, and follow-through. To ensure that the program is effective, the plan needs to further enhance and solidify understanding of its compliance program through surveys of staff and associates and regular monitoring and auditing of its external providers. CMS requires compliance programs to prevent, detect, and correct Medicare Parts C and D noncompliance and fraud, waste, and abuse in a timely, well-documented way. Documentation matters. It shows that we did what we did when we did it, and why, and what was the outcome, resolution, and follow-up. A key reminder in compliance is to document, 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 because if you did not document, it may be treated as if it did not happen in the eyes of CMS. Takeaway from this slide should be that you must document clearly, concisely, and consistently, because documentation proves what has happened. CMS wants to see through our compliance program who we are. That includes our organizational structure and the operations that support a Medicare Advantage prescription drug plan. CMS looks at our functional areas, governance, monitoring, auditing, reporting processes, and overall effectiveness. The goal is to confirm we have the right roles and accountability, and that our program works in practice and not just on paper. Takeaway from this slide would be that CMS evaluates both design and effectiveness, not just written policies and procedures. CMS also wants to see our processes. That includes training and education of new hires, annual refresher training, and job-specific training. CMS reviews our policies, our internal monitoring and auditing, and our oversight of first-tier, downstream, and related entities, sometimes called FDRs or delegated entities. CMS evaluates how we communicate compliance information and how we document adherence to regulations and guidance. The takeaway from this slide should be about training, policies, and oversight that must be active, current, and well documented. CMS also wants to see how we respond when something goes wrong. That includes how we handle reported noncompliance issues, how we document the issues, and how we correct the deficiencies, and how we validate that those deficiencies or issues of noncompliance have been corrected. CMS looks for timely completion and resolution, appropriate reporting, and ongoing monitoring to confirm that we fixed the problem, that it worked, and it stayed fixed. When we identify, correct, and validate to prevent recurrence of an issue. A takeaway from this slide would be that Elite Health Plan needs to respond quickly, identify the root cause or any beneficiary impact, correct it, and confirm that the corrections put in place have actually fixed the problem over time. Our compliance program is supported by policies and procedures across many areas, including but not limited to our standards of conduct, confidentiality of member information, claims processing, contracting with vendors, suppliers, and delegated medical groups, marketing and advertising of our products, enrollment and disenrollment of members, and the rights to grievances and appeals for members, and fraud reporting. Policies also cover workplace conduct, such as honesty, theft, harassment, discrimination, and safety of everyone at the workplace. These policies set expectations and protect members and the plan. They apply to employees and business partners. A takeaway from this slide would be know the standards of conduct and use the policies as your guide for daily decisions. Violations of our standards of conduct can lead to disciplinary actions. Depending on the situation, these may include counseling, training, or education, verbal or written reprimand, impacts to raises or promotions, suspension without pay, demotions, termination or suspension of a CMS contract. In some cases, violations may be referred to law enforcement. Accountability is essential to an effective compliance culture. The takeaway from this slide should be that accountability supports trust, and consistent discipline supports a culture of compliance. A conflict of interest happens when personal interests interfere with your duty of loyalty to the organization and our members. Examples may include self-dealing, outside employment that creates a conflict, family interests or nepotism, or accepting bribes. If you are unsure whether something is a conflict, disclose it as promptly as possible to Human Resources and ask for guidance. Early disclosure protects you and protects the plan. Takeaway from this slide should be that disclose conflicts early and avoid even the appearance of improper influence. In this next section, we will focus on fraud, waste, and abuse, sometimes called FWA. Understanding fraud, waste, and abuse helps us protect our members, prevent improper payments, and meet CMS expectations. We will review definitions, examples, and how to report concerns. Takeaways from this slide should be that fraud, waste, and abuse prevention starts with awareness and timely reporting. The definition of fraud is that it must be first intentional for it to be criminal. Fraud is an intentional perversion of the truth for the purpose of inducing another to part with a valuable thing or belonging or to surrender a legal right. It must be done by statement of fact, by false allegation, or by concealment of material fact. The takeaway from this slide is that fraud must be intentional. Someone must rely on that fraud. What is the definition of abuse in the healthcare system? Healthcare abuse is the use of practices that are inconsistent with accepted medical, business, or fiscal standards that result in the unnecessary costs to a healthcare program, improper payments, or services that are not medically necessary. It's important to remember that fraud is an intentional deception, while abuse is generally improper practice without intent, but both can violate program rules. The key elements of abuse typically involve services that are not medically necessary, excessive services, improper billing practices, misuse of codes, coding, or documentation, and inefficient or poor quality care. An example would be a physician who orders repeated MRIs every 6 months, even though the results for the individual patient are normal and no symptoms exist. This is abuse because the services are unnecessary and create cost, even if the physician believed they were appropriate. Here is a practical comparison of fraud versus abuse. Fraud might look like billing for a PET scan when an MRI was actually performed, or upcoding an MRI is a more expensive test. Abuse might look like ordering MRIs every 6 months for years, even when there is no medical justification and results are consistently normal. Fraud is criminal. Abuse is typically not criminal, but still unacceptable by CMS standards. The takeaway from this slide should be, when intent is unclear, report concerns, and let the experts investigate and determine whether it is fraud or abuse and or both. Healthcare fraud can involve providers, consumers, agents, brokers, members, or employees. Provider fraud can include false claims, incorrect billing schemes, falsifying diagnosis or dates of service, fraudulent pharmacy claims, kickbacks, underutilization of services, overutilization of services, or improper referrals. Consumer fraud, including members, can include receiving benefits they are not entitled to, application fraud by omitted facts, eligibility fraud, or foreign claim schemes. Employee-related fraud can include enrollment or application fraud, falsifying advertising, misrepresentation of products, improper replacements, churning or twisting membership, or misrepresenting provider networks. Takeaway from this slide should be that fraud can come from many sources, so stay alert across all workflows. Reporting suspected fraud or issues of noncompliance is a 3-step process. Step 1, report it through your supervisor, compliance, or the fraud alert hotline. Elite Health Plan has a non-retaliation policy that no adverse action will be taken against anyone who reports in good faith any issues of noncompliance or fraud, and that reporting may be done anonymously. Step 2, provide enough information so compliance or the certified fraud examiner can investigate the claim. Step 3, investigation. Compliance and/or the SIU, a Special Investigations Unit, may involve the appropriate parties, summarize findings, and take appropriate action, and report this information up to the governance structure of the organization. Takeaway from this slide should be reporting in good faith is protected and anonymity is available and guaranteed if reported in good faith. How to report fraud and suspected issues of noncompliance. Here are the reporting options. You can contact the fraud hotline at 855-894-4982. You can mail in information about fraud to Fraud Alert Compliance at 1131 West 6th Street, Suite 225, Ontario, California, 91762. Or you can be guaranteed anonymity if reporting in good faith to the website at https://report.centrio.com/elite health plan. You can also email any suspected issues of noncompliance or fraud, waste, and abuse to reports@centrio.com. With this, you must include the company name with your report, and that would be Elite Health Plan. Reporting is available 24 hours a day, 7 days a week to the hotline and to the website and email. And you are protected from retaliation when reporting in good faith. Takeaway from this slide should be use the hotline or online tool whenever needed, even if you're unsure. Information security. Information security protects information and systems from unauthorized access, use, disclosure, modification, or destruction. So we can maintain confidentiality, integrity, and availability of our information. Protect information through use of strong passwords, access controls like coded access to documentation areas, PIV cards, and use approved password-protected USB devices internally and externally for the movement of information and medical records. Never, ever share your passwords with anyone. Be alert for tailgating. Use screen locks and privacy screens. Use VPN access that is required for all EHP systems, and follow permission levels for sensitive data. Limit personal use of company internet. Watch for external email warnings by hovering over the email address to see if it's the actual email that matches the company. Be aware of warnings that it is an external email, and use the encryption feature when required. Dispose of documents properly using cross-shred bins or cross-shredders, and protect devices and hard drives at all times. Takeaway from this slide should be protect the data the same way you protect our members, carefully and consistently. Cybercrime is any crime involving a computer, tablet, smartphone, device, and anything hooked to a network. Many cyber attacks rely on social engineering, which is the manipulating of human behavior to gain access to systems and information. In these cases, attackers exploit trust, the desire to help, fear, and curiosity. Phishing and whaling emails, while they may look legitimate, whaling emails are aimed at senior officials or people purporting to be senior officials attempting staff members to change information or get additional access to accounts, believing that their boss or CEO is requesting that change be made. Other threats include malware, internet hoaxes, and Trojan viruses. Be cautious with email and use encryption when required for any external communications that involve protected health information or personal identifiable information. Takeaway from this slide is slow down with unexpected emails. Verify that email address before you click or respond. Preview some of the language to ensure that it's cohesively written. Remember, AI is getting smarter every day as well, and this is now being used for cybercrime with emails. HIPAA and HITECH are regulations that focus on privacy. If you suspect a breach of information, report it immediately to compliance. The Health Insurance Portability and Accountability Act protects confidential information such as PHI, which is protected health information, like diagnosis, medical records, and labs, and PII, which is personal identifiable information, protects information such as social security number, date of birth, address, etc. Sometimes we use limited or minimal data sets for a specific purpose. This way we can release information publicly and remove all PHI and PAI that may be impacted to the member. Ensure that you secure all emails and manage information properly. This is done with business associates and/or first-tier, downstream, and related entities. Violations of HIPAA and HITECH are managed by the Office of Civil Rights through the Department of Health and Human Services, and these are separate violations outside of CMS that can lead to monetary penalties, and retaliation for good faith reporting is prohibited in this area as well. HITECH also has increased enforcement and penalties for privacy violations and breaches. Takeaway from this slide should be PHI and PII must be protected, and breaches must be reported to compliance promptly. A frequent question in Medicare Advantage organizations, particularly with staff members who work directly with the public and our members: can you release information to someone representing a member or to a family or friend? The answer is yes, but do not share with them any information related to diagnosis or condition. Any release of this information cannot be done without proper representation or authorization. Confirm legal authority first before releasing diagnosis or condition information. Items accepted would be a power of attorney that directly reflects the ability to work in the healthcare sector, conservatorship by a judge, executor documentation for a will and/or estate, or an approved representative form from CMS or the company, or an advance directive from the state that the member resides. These documents should be retained and reviewed before releasing sensitive details. Takeaways from this slide: verify authorizations before sharing, especially for diagnosis and/or condition details. You can set a new appointment for a member, help to get an authorization through clinical services, but you must be careful on the information that you release without any of these documents. Some common forms of authorization include the appointment of representative form, which is the CMS 1696 form, or a HIPAA records authorization form, allowing representation for claims, services, service issues, grievances, and/or appeals. A power of attorney for healthcare may apply when someone cannot make healthcare decisions on their own. Other powers of attorney may authorize enrollment support, appeals, or just primary care changes. If you have any questions regarding durable power of attorney documentation, please forward this to compliance for final review. A conservatorship may be used, or court-appointed guardianship, which provides broad authority, and this is done through a judge. An executor of an estate handles legal matters for a deceased member, and documentation should be readily available to prove that they are an executor of the estate. When you receive documents, follow policy to validate and record it as appropriate. The takeaway from this slide should be: when documents grant authority, follow policy to validate and record them. In California, there is a common use of the Advanced Healthcare Directive form, which supports healthcare decision when a person cannot make decisions on their own. There are requirements for who can sign and rules for witnesses. For example, skilled nursing facility or facility staff cannot sign, and witnesses cannot be facility staff or beneficiaries of a will or estate. When directive questions arise, follow policy and document changes to healthcare agents when required. Takeaway from this slide is to follow California rules for directives and witnesses and document correctly. Any questions on California advanced healthcare directives may be forwarded to compliance for final review. Anti-discrimination and limited English proficiency requirements help ensure equitable access for everyone to our healthcare services. Key expectations include a multi-language insert and visibility of an anti-discrimination policy within our documentation sent to members and also within our headquarters and offices. Documents may require translation based on thresholds and standing requests. In the counties that we serve of Los Angeles, San Bernardino, and Riverside, the language threshold for 5% and more applies to Spanish translation. All other language requests would be standby, meaning that when a member requests a language once, communications must continue in that requested language, and it must be recorded within our systems. Interpreter services must also be available and must include American Sign Language. Members also have the right to request alternate formats of our documents, such as large print, braille, video, written transcriptions, or recordings. Grievances related to discrimination must be handled appropriately. Separate harassment and class training is offered and required in some respects when dealing directly with our members to ensure that we are cognizant and respectful in the way we provide services. Takeaway from this slide should be that language access is a right and communication must meet our members' needs. Monitoring and auditing are continuous and ongoing. Here at Elite Health Plan, we track metrics and conduct audits across claims, various functional areas, and our PBM, including grievance and appeals, sales and marketing, website and social media, health services utilization management, and quality management. We also oversee delegated providers and require that they train, monitor for sanctions, and complete attestations that prove to us that this has been completed. Additional monitoring includes Part C and D reporting, performance outliers, complaints tracking, star ratings, CAHPS and HAWS surveys, HEDIS measures, call center monitoring, CMS and Medicare Patrol surveillance, marketing material reviews, provider directory and PBM directory search audits, formulary accuracy, ANOC and EOC material verification, member notifications, and appeals, including utilization management requirements. Takeaway from this slide should be that monitoring and auditing are continuous and ongoing and make for strong controls and reduce findings within audits. It's important to remember that we are continuously being monitored and audited, not only internally, but by external organizations and our members, and our suppliers, and our vendors, and our providers. These include Centers for Medicare and Medicaid Services, the Department of Managed Healthcare, Department of Healthcare Services, Department of Health and Human Services, and anything to do with Medi-Cal. Federal oversight includes the Office of Inspector General, Department of Justice, and Health and Human Services, and the Office of Civil Rights. Senior Medicare Patrol supports fraud prevention. Oversight can come from employees, vendors, competitors, and members. Anyone can call 1-800-MEDICARE, and anyone can be a whistleblower. Takeaway from this slide should be that oversight is broad, so assume anything can be reviewed at any time. So we must always ensure that we are compliant. This slide is a review for just some of the audits that the health plan can go through on an annual, quarterly, or monthly basis. This is up to in addition to reporting for Part C and D and our internal monitoring efforts. Audits are not easy, but we use them as a learning process, which helps us to enhance our processes through performance improvement, corrective actions, and other areas. The process can include an audit notification call, pre-audit documentation requests, and uploads and many meetings associated. During audits, teams respond to daily document request lists, conduct root cause analysis, and complete beneficiary impact analysis. Auditors may issue preliminary draft reports, then draft reports, and final reports. The plan may submit corrective action plans, followed by validation audits. Enforcement actions, including civil money penalties or sanctions, are public. The key lesson is to stay ready through consistent compliance and strong documentation. Takeaway from this slide should be audits are rewarded through ongoing preparation. Always be audit ready, so keep recognizing that records should be organized, and documentation and follow-up and support should be done timely. Does it pay to follow the rules and stay in compliance? Yes, it does. Extrapolation in certain audits can turn a very small error into a large financial impact. Consequences, in addition to extrapolation, can include notices of non-compliant, sanctions, warning letters, civil money penalties, and these sanctions can include items such as the plan's inability to enroll or market. Other outcomes may include trouble damages that can be implemented by the Office of Inspector General on top of CMS civil money penalties, or debarment by individuals or an organization from federal programs, which means any program that is supported through federal funds. Strong compliance protects members, protects our reputation, and protects our ability to serve and provide access to our members. Takeaway from this slide should be that non-compliance is costly, financially, operationally, and reputationally. Our compliance landscape includes many laws. These include False Claims Act, qui tams, the federal sentencing guidelines, anti-kickback statutes, safe harbors, and Stark laws related to physician referrals. Other important laws include Beneficiary Inducement Statute, HIPAA and HITECH, Sunshine Act, the Affordable Care Act, No Surprises Act, and most recently, the Inflation Reduction Act. These laws shape how we bill, market, contract, and protect information. Takeaway from this slide is that laws set guardrails and our policies operationalize them. If you have any questions regarding any of these laws, please feel free to contact compliance and we can review any one of these in depth as needed. Please remember that questions to compliance are always welcome. If you have a compliance question, contact compliance early. It's always better to ask than to guess. Compliance can help you interpret requirements, clarify documentation expectations, and choose the safest option when issues arise. Takeaway should be, if you are unsure, ask compliance. Early questions prevent late problems. Thank you for taking this training, and please let us know if you have any questions.